Hi, how you doing today?
Hey, how you doing?
Dr. West. Yeah, I'm Kanye's cousin. What's your name?
Mike.
Mike. Okay. Nice to meet you, Mike. Hey, what's on your shirt, man?
Trust no one.
Trust no one. That's hot, yo.
Mm-hmm.
Can I get one of those?
Yeah, maybe.
Maybe? Okay.
Yeah.
Alright, so tell me, what's going on today?
Well, I think I have genital herpes, doc.
Genital herpes?
Yeah.
Why? Why do you say that? What's your signs or symptoms?
Well, I mean, I don't have any signs or symptoms, but, I have been tested. I was tested a year ago. It was negative. And I got tested again last week, and I was negative last week, but honestly, I just think the tests are fake. I think the doctors are giving the wrong results.
You think so?
Yeah.
More than likely. How many sexual partners have you had?
Well, only 3. 2 of them were random one-night stands I had in college, and then one was a girlfriend that we dated for 2 months. But I think she's the one who gave me my herpes because she was cheating on me when we were dating the whole time with my brother.
Damn, that's crazy. Did you at least wear protection, man?
Yeah, I mean, I wear protection every time. And, I mean, I had those tests, the one a year ago, and I don't have any symptoms. I had the one last week, and, I mean, I know that these tests say I don't have it, but I just don't trust these doctors, honestly. And I haven't even had sex in a year because I just don't trust anybody anymore with my body.
Well, hey, this is a little too crazy for me, man. I'm gonna be right back. I need some help.
What?
I'm gonna be right back, man. Just hold tight.
Hi, Mike. How are you doing today?
Good. Where's Dr. West?
Dr. West actually had to go help another patient, so he sent me in here to help you.
Why?
I'm Brandy.
Well, where's Dr. West?
He went to go help another patient, but he's explained the situation to me, and I just want to kind of get the information from you myself. And so you've had 2 tests that have both come up negative?
Yeah, I told him I had 2 negative tests.
And you've had no sexual encounters since then?
No, but you're not listening to me. I don't trust the test. I want another test today.
Okay, is there a specific reason why you don't trust the test? Because
Yeah.
to me it seems like you're being a little bit paranoid.
No, I'm not being paranoid. You don't understand. My girlfriend was cheating on me with my brother.
Did you catch her in the act of cheating?
That's besides the point. You're not listening to me.
Okay, well, you're not listening to me. What I'm trying to tell you is I think you're just being a little bit paranoid. You've had 2 tests and they've both come up negative.
No, you're not listening to me. I want another test.
Okay, well, if I give you another test and it comes up negative, are you going to trust me or are you not going to trust me just like you didn't trust your other doctor?
I mean, honestly, I don't trust any of you anymore. I don't trust any of you doctors. I mean, first I had Mr. West, and who are you?
Okay, well, if you don't trust me, then I don't really know what I can do for you. So I'm going to leave you here and you decide what you want to do.
Are you serious?
What you've just witnessed is an example of paranoid personality disorder, a pattern of distrust and suspiciousness such that others' motives are interpreted as malevolent, beginning in early adulthood and present in a variety of contexts as indicated by 4 or more of the following diagnostic criteria. Suspects without sufficient basis that others are exploiting, harming, or deceiving him or her. 2. Is preoccupied with unjustified doubts about the loyalty or trustworthiness of friends or associates. 3. Is reluctant to confide in others because of unwarranted fear that the information will be used maliciously against him or her. 4. Reads hidden, demeaning, or threatening meanings into benign remarks and events. 5. Persistently bears grudges, is unforgiving of insults, injuries, or a slight. 6. Perceives attacks on his or her character or reputation that are not apparent to others and is quick to react angrily or to counterattack. 7. Has recurrent suspicions without justification regarding the fidelity of a spouse or sexual partner. The prevalence of paranoid personality disorder has been reported to be between 0.5 and 2.5% of the general population, 10 to 30% among those in the inpatient psychiatric settings, and 2 to 10% among those in the outpatient mental health clinics. In clinical samples, this disorder appears to be more common in the male population. It should be noted that this falls under a cluster A personality disorder, which also includes schizoid and schizotypical disorders. People with these disorders often appear odd and eccentric. And now my colleague Teresa will go over some of the etiology and treatment of the disease.
Thank you, Amanda. Hi, my name is Dr. Nguyen. Some studies have evidence that adolescents with PPD have a higher rate of violence and criminal acts in adulthood. PDD has been shown in adults who have been abused or neglected as children. There may be some correlation with PDD and later development of schizophrenia spectrum disorders. The cause of paranoid personality disorder remains unknown. It may be hereditary and seems to be more common in families with a history of psychotic disorders. Without treatment or intervention, a patient's paranoia can worsen and possibly lead to other psychiatric disorders. Paranoid personality disorder is difficult to treat since patients suffer from extreme suspiciousness of others. Persons with the disorder are not likely to seek treatment, so there's a lack of information and research on treatment of PPD. In general, psychotherapy is a treatment of choice for paranoid personality disorder. Anti-anxiety medications may be prescribed if the patient suffers from severe anxiety. However, a healthy doctor-patient relationship is extremely important for success of any kind while treating this disorder. In the previous example, the physicians did not empathize with the patient and ignored his suspicions. The doctors were also very defensive when their knowledge was threatened, which in the end caused the situation to exacerbate further. The patient felt angry, frightened, and defensive, which would confirm his suspicions of physicians and those around him even further. Now, let's look at how this situation could have been handled better, providing our patient with better treatment outcomes.
Hi, Mike. How are you doing today?
Good. Where's Dr. West?
He had to step out for a minute. My name is Rose, and he told me that you're concerned about an STD.
Yeah, I am.
Can you tell me about it, please?
Well, like I told the other doctor, I think I have herpes. I mean, I've been tested twice and they're
Okay.
negative, but I don't trust the results, honestly.
Okay, I understand that you're worried, so I'll go ahead and write down here to order you another test, but can I ask you a couple questions before we get you tested?
Yeah, so we're gonna do another test today?
Yes, we're going to order you another test.
Yeah, sure.
Okay. Can you tell me about your past relationships?
Well, like I said, I had a girlfriend, but like I told the other doctor, she's been cheating on me with my brother the whole time we were dating, and honestly, I think she's really after me for my money. My dad, he's a dean of a pharmacy school in Hampton, so I come from a lot of money, and I'm just really worried that she has ulterior motives, which is why she's even dating me.
So, did you ever catch her cheating on you or trying to steal your money?
Well, not like directly, but she used to go out and study really late at night with like 2 different guys from her class, and that made me suspicious. And then one time she told me that my brother, she thought he was really funny, and like I don't know, my brother, he's always been really nice to me like throughout my whole life, and I think he's just doing that as a way to cover up what he's doing behind my back. And then she asked me if we could move in together, and I thought that was like really soon because we just started dating. So I just feel like she was just trying to get in with my family, honestly, because we come from money, and that was her first way in.
Yeah, well, I definitely understand what you're saying, and I think that you need to explore these feelings further. And I have a partner who kind of specializes in this. Would you be willing to make an appointment with him? I think that it would really, really benefit you.
Maybe. Is it something I could get back to you on?
Yeah. I mean, you can take your time. It's no rush. But I really do feel strongly that it's something that will help you in the long run.
Okay.
All right, and now let's go get you tested.
All right.
Hi, my name's Eric. I used to suffer from paranoid personality disorder. It was horrible. I used to be suspicious of everyone, including my dog. I thought my family was planning and plotting to kill me. I couldn't hold relationships for more than a week. My life was filled with distrust and just a lot of anxiety. But went through a lot of therapy, and saw a psychiatrist who prescribed me some anti-anxiety meds, and I've been doing pretty well. Like, I just want people to know out there that there is help for you. You can overcome paranoid personality disorder.